many nights thinking how you did me wrong, and I grew strong, and I learned how to get along.
Absolutely. I've been teaching here almost 25 years on and off. I can tell you within the first couple of classes who my students are that are self-directed, who excels, and they're the ones that come and ask questions. They're the ones that I see in my office. They're the ones that get the benefit of having spent that time with me. You know, they'll come and say, oh, Mary, I'm working on this paper, but, you know, can you read it over, can you look at it? Or, I didn't really understand what we talked about in class, or, you know, any of those kinds of things. So, yeah, you're going to get a lot more one-on-one by introducing yourself, and it makes a good impression on your professor or your faculty. Yes, yes, and yes. I think the three biggest problems that students have right now are patho, pharm, and math. I say that because I teach fourth track, so I teach community, and one of the assignments in community is my students have to do 1,000 NCLEX questions, which begins to get them prepared for fifth track, but it gets them a little earlier start, and then they can kind of go through and then they self-evaluate when they take these tests. Well, what are your weak areas? What are the areas you didn't do so well in? And like I said, pharm, patho, and math just bubble up to the top. Okay. So yes, I recommend, and we're going to be doing some study groups actually for those three areas this semester, but what I recommend is you get a 3-ring binder and you put some tabs in there. You have one tab for your meds, one for your diagnostic tests, one for your lab values. And maybe you want more tabs, that's up to you. But when you start going to clinicals, okay, make a list of all these meds that you're running into. That was an easy answer. I said all of them.
Yeah.
All of them. You will go back, and this is what my fourth track students are running into now. It's like, oh geez, you know, I forgot some of this OB, or I forgot some of the fundamentals, or I forgot, you know, research or whatever, and they're kind of wishing they had those books. It's the biggest mistake, especially first track, that you could ever make is to miss a class.
You get in the habit of it, it's not good. My first thought, my answer to that was be self-directed. You know, keep up with your reading. Always go back and review your materials. One of the biggest mistakes that people make, I think, is that they study for the present. So if you've got 3 chapters to read this week in patho, I'll just use patho as an example, you forget to go back and study the other 2 or 3, and then when it comes time for the test, it's been so long since you've looked at that material. So, you know, academically, I think, you know, it's a heavy workload. The workload will always be heavy, but I always tell students, you know, learning is a lifelong experience in nursing, and if you don't like it now, get out of the business, you know, because you don't want to be in it, because we're always learning, we're always studying. You're going to be a self-directed learner all your life. Yes and yes. It's stressful because these are live bodies. Yeah.
You know, I mean, it's the real world, and as much as we try to treat sim as a live experience, you know, when you first have that patient and you're putting that needle into a live body, it's scary. You know, it is. And it should be scary, you know. To a certain extent, it should be scary enough that it makes you respect what you're doing and you don't take it for granted. So it keeps you humble in that respect. But it should be fun, because it's what you're here to do, you know, it's why you're here. And if it's so scary or so stressful that it's not fun, then you probably should come and talk to somebody. Come and talk to me, talk to your mentor, talk to your faculty. You know, if it really gets to be too anxiety provoking, talk to one of us, and I gave you guys that list of resources, you know, but talk to somebody. In nursing, you can't afford the luxury of fading, because people's lives depend on, you know, you being sharp through the entire shift. So I always say, you know, get a good night's sleep, have a good breakfast before clinicals, study ahead of time. how you do in clinical is really directly related to how well you've done in your theory classes. How well you do in your theory classes is really related to how well you do in patho. Because if you don't understand patho, you don't understand med-surg. And we have a big problem with that with students who are, oh, I'm happy to get a C in patho. Well, you know, then you're only going to have C-level knowledge in med-surg and everything else. And that's not going to be a good thing because your chances of passing down the road are not going to be very good. Nursing exams are unlike anything else you're ever going to experience. Generally, when you take a test like a biology test or an anatomy test, you memorize and you're tested on what you memorize. Yeah. In nursing, it's two parts. You have to understand, and I equate it to being a car mechanic, not that they're anything close, but you need to understand the mechanics of your car, the engine, the parts, all those pieces. You need to understand, which is the moral equivalent of anatomy and physiology. You need to understand how it all works. Then when your car's broken, you need to understand what's happening and why it's broken. If your brakes are, you know, if you can't stop your car and your brakes are bad, well, this isn't, you know, you're not going to go look at your timing belt. You're going to look at your brakes. So you need to understand all those things. Then you have to go to the manual to figure out how to fix it. And then you apply what you learn in the manual to how to fix it. Well, nursing is the same way. You know anatomy, you know physiology, you're learning patho, which I'm sure you're all enjoying. And then we start the med-surg, the fundamentals, the peds, OB. Well, that's your evidence-based practice. That's your theory. So if you've got a patient that's got some piece of heart disease, say they're having a heart attack or a stroke or whatever, you have to understand the parts of the heart. You have to know how it normally works. You have to know what happens with a heart attack. Then you have to know evidence-based practice in nursing, which says, how should we take care of that patient? So nursing tests are two-part. They're, one, you have to know the anatomy, the physiology, the pathology, but then you also have to understand what is evidence-based practice and how you care for that patient. You have to figure out what kind of a learner you are, what environment you study best. Do you study better by yourself? Do you study in groups? Sometimes a little bit of both is good. You know, reading the material, I encourage students to study in groups, but come to the table prepared. Yes. Read, study, know what you know, identify what you don't know, and then interact with other people and teach it to each other. One of the things that I tell people, how do you really know you know the information, is when you can teach it back to somebody in your own words. Because then you've been able to internalize it, you understand it, and you can feed it back. If you're feeding it back to somebody using exactly the same words that's on your notes, you probably don't understand it. I suggest that you read your book. You know, I know there's chapters and chapters and chapters to read, but pace yourself, read, highlight the information. If there's terms you don't understand, look it up. Make Google your best friend. Yeah. Even now, when I don't understand something, the first thing I do is I Google it. You know, so don't hesitate to do that. Go back to your textbooks, whatever. Excuse me. Don't be afraid to ask for help. You know, reach out to your faculty. We have a mentoring program now. I don't know if you know much about that. The 5th track students, as part of their leadership experience, have to do some sort of leadership opportunity. One of which is they can volunteer to be a student mentor. And so on my door, in room 158, in my door, is our forms. One is I either want to be a mentor, or I need a mentor. So if you find that you need somebody that you would like to study with, mentors are great, and it's good review for the mentors because they're getting ready to take NCLEX. So it's win-win for everybody. That's good. My advice is get ahead of the game. You know, study, be prepared. If you're trying to wait till the last minute to cram for a test, the anxiety level is going to be way up here. And I think figure out what it is. You have to go back and you have to ask yourself, well, why am I bothered by this? You know, is it that I don't know the content? I don't understand the content? Is it that I'm scared of taking tests? Is it that I don't do well on nursing question tests with the application part of it? Some students will tell you, I hate the NCLEX-like questions that say any of the above. Figure out what it is that's provoking the anxiety. It may be that you're having trouble with the length of the test. It may be being in a classroom with so many people. So you have to drill down, figure out. I always say, I put in here, you got to figure out what's broke first. So we can help you fix it if we can figure out what the problem is. So you kind of have to dissect the anxiety and the frustration, figure out what it is. And, there's plenty, like I told you, there's plenty of resources. Talk to your professors, talk to me. It's just nothing should be so anxiety provoking or stressful that it makes you so that you can't function. I think, all of the above. Third track is tough because of the med surge. There's just I never realized it could put that much information between the front cover and the back cover of a book. So, your third track, your med surge is really heavy duty. You've got pharm that semester. You've got, so you've got a lot of content that either makes you or breaks you. If you don't go into third track with good study skills, with a strong understanding of patho, being organized, and just having good healthy habits, getting good sleep, eating right, taking time for yourself. If you don't have that structure in your life, then third track could be really tough. Keep a calendar. I'm amazed at the number of people that I talk to in student success that don't have calendars. They have a piece of paper here with this test or this or that, but there's no schedule, and you'll learn real fast in nursing that you just, to stay alive, you need to have a scheduler or a calendar or something. So that's the first piece of advice. Block out time for studying, just like you block out time for being in class, block out study time. I put structure. To be successful through these 5 semesters, you have to be structured. If you just decide you're going to deal with something whenever the flavor of the day hits you, you're going to be in trouble. I agree.
Yeah.
And just like I told you with balancing, the amount of credit hours. But sometimes people have to, I'm a realist. And if you're going to do that, then you need to figure out, go back to your calendar. This is when time management is so important. You schedule that in just like you schedule everything else. And, you may recognize that it may not work for you. So I encourage people that, if they're having problems, come talk to me or talk to your professors or whatever. And sometimes, maybe there's alternative sources of financial assistance. We can send you back to financial aid, or, it might be a way to help you try to figure out some way to balance it. But if you don't have to work, don't do it. As you get further along, yes, you may want a CNA position or something that'll help you. And I understand that, but, to try and say, oh yeah, I'm going to work full-time and go to school full-time, it just doesn't work. Bad things happen.
At first I was afraid, I was petrified, kept thinking I could never live without you by my side. But then I spent so many nights thinking how you did me wrong, and I grew strong, and I learned how